Yeah. Nina Teicholz, in her latest post on Unsettled Science, asked the question whether there's currently sort of propaganda efforts to suppress these claims that processed carbohydrates or excess carbohydrates or too much sugar are a source of a lot of our chronic conditions. So I just posted on Facebook yesterday a study finds article that chronicles a study from Australia that shows that people who went on a low carb diet, that is keto, low carb carnivore, it says they were more likely to have type 2 diabetes. Okay, wow, that's a scare story. And you read that, and you think, wait a minute, I thought these guys said this. Well, Nina Teicholz goes in and looks at the study, and it is not a very well done study, and it stretches to say the least. And there are a lot of studies like this. There's a whole network of people who are saying, eggs are bad for you, cream's bad for you, saturated fat, meat is bad. And these things should be researched. I guess the exciting thing to me is, I mean, the critic would say to someone like me, saying to the family, you've got to research your own medical care. You can't just rely on any doctor. Um, and guess what? These are the same critics are saying you can't just educate your students at home. What do you know? You need to have a
Yeah.
teacher who's got a degree from a education school because you can't possibly know enough to educate your own children. Well, guess what? The medical care providers are running through a very similar system, something like just a few hours, and their whole medical degree is on nutrition. But if nutrition is the root of our health and our chronic disease, it's really important. So they defer to nutritionists who go through another college where you'll find much funding comes from the food industry and pharmaceutical industry, and they're still saying, have 7 meals a day and have whole grains and lots of fruits and vegetables, and except the research data to support that is very limited. Um,
Yes.
so it's going to be a challenge for students. And every time I go to a homeschool tournament and look at the food that's provided on the snack trays and at the meals, I can tell which parents have been researching metabolic health. You see
Yes.
sticks and you see high fat, low carb things, not just the super cheapest stuff from Costco. Um,
Yeah.
I
Yeah.
I very
My tournament, I provide home cooked meals. We do brisket and pulled pork, and
yeah.
we have lots of protein that helps get you through.
And when I look for pulled pork and other brisket-like things at Trader Joe and other places, it all has sugar in it.
Yeah.
And you
I
don't
don't.
need sugar. It's fine.
Yeah.
Sugar's fine for a cake. I can bake my own cookies without sugar, and they last a long time because they don't taste very good. So
Yeah.
sugar is appropriate in limited amounts in some places, but it
Yes.
doesn't have to be in everything. And these are, you know, telling children that too much sugar is bad for them or hurts them. These are important things to research for parents. And I've learned from experience that it's not a good idea to tell parents they're making mistakes raising their children. Uh,
Yeah.
let them discover the better ways themselves. But food is really important and it's part of the healthcare system. It's not a nutrition topic, but if nutrition is key for healthcare, it is part of the healthcare system. Or at least the government should stop doing things that are hurtful, that are counterproductive. And the story is that is exactly, unfortunately, what has happened since Ansel Keys and the food pyramid. Now it's the food plate. The major organizations promoting misleading ideas for diabetes is the American Diabetes Association. And you can
Yeah.
look at their website in US and in Canada and see the diet they recommend to type 2 diabetics. Um, so
Yeah.
you can look instead to the American Diabetes Society, a new organization that's set up with the argument that they have better science behind their recommendations for diabetics and pre-diabetics.
Yeah. And really what a lot of this comes from, which is, you're also an economist, uh, the lobby, the amounts of money that are being put into the government by the lobbyists. You've got the sugar lobby, you've got the corn lobby, you've got, all of these lobbyists that are pushing for their industry on government officials that may not know really a whole lot because they're not out there researching all of this. They're being wined and dined by these lobbyists. So the money, follow the money, and that's where a lot of this is. It is where you find the loads of money, you're going to find the lobbyists and the decisions being made by the federal government for the lobbyists. And
Right.
so you have sugar subsidies, you've got corn subsidies, you've got all these subsidies now, and you've got so it's the money that's going back and forth, and it's not sound science, and it's not helping us in our health or our nutrition.
And debate is the ideal forum for discussing these issues because economists talk about regulatory capture, that government agencies set up to regulate an industry, like the railroads. So the Interstate Commerce Commission is set up originally to regulate the railroads to make sure they're not charging too much and this and that. But over time, the railroads have much more influence over the ICC. And actually, railroad lawyers actually wrote the ICC regulation because in reality, in American history, it was designed to stop small railroads from competing with big railroads. So
Yes.
now the federal agencies that regulate the pharmaceutical industry in a sense, are protecting the major pharmaceutical companies from competition from small companies because the small companies can't get their stuff approved. Many of the drugs that are very effective for chronic conditions can't be patented. So you can't get approval formally because you can't raise enough money to do the proper study that the federal agencies insist on. So these sorts of things are worth students. But the key is that there are very good doctors, good pharmaceutical companies, incredibly effective medications that have saved huge numbers of lives. And those are mixed up with other medications that maybe aren't so useful anymore, but they're still out there. They're still being promoted. Doctors don't have time every day to read all these studies to find out which are the most effective. And students will find things like ivermectin and other controversial drugs that came up during the pandemic. Um, they'll find a number of things. One, there's still controversy over what's effective and what isn't. And they'll find the federal government and federal agencies are out there pushing the social media companies to censor information about drugs and procedures they don't approve of.
Right.
What's that about? So it's worth
Yeah.
students researching.
It's yeah, and a lot of that again is follow the money. Who are the lobbyists? How much are they putting into the system in order to change minds? And money does tend to change people's minds about things because the politicians want to stay in power. And so if they can get powerful lobbyists to support them and they get more money in order to put out more of their campaign ads, they can hire more people to go door to door and all of that. It's follow the money, and all of this ends up the costing us as the citizens because we have in the United States the highest in the world, highest healthcare costs in the world. We're putting out roughly about 5,000 more per person per year in healthcare costs than any other country, and yet our life expectancy is, it's at the higher end of average, but we certainly aren't reaping the benefits for the amount of money we put into healthcare. So
Yeah.
healthcare cost is one of the big issues.
And healthcare costs is a big issue. I would emphasize a couple things. It's okay for a rich society to spend more on healthcare. That's one of the advantages of being wealthy. It's like driving a safer car. It keeps you safer if there's an accident. So it's okay to spend more on healthcare. We don't want to waste money on healthcare. And economists look at the incentives. Um, the doctors, the companies, if they earn more money with more surgery and more procedures, they they can become biased in that direction as well. So, a doctor, so when you've got problems, what's the best thing to do about it? Uh, Obesity, for example, they were prescribing bariatric surgery, that is surgery on the stomach, putting bands and other things, and they're still recommending that for children, for young people as a way to deal with childhood obesity. But they won't recommend cutting back on carbohydrates
Right.
because it's a nutrition thing. And they might say, it's out of my lane. They're not nutritionists doing that. And the nutritionists won't recommend that. They say, have pasta, just exercise more. So getting at the root of these things, you want to incentivize. And I guess the key thing is people find success at this. So this whole movement, we're going to have Brian Lenskis, who has the Low Carb MD and Life's Best Medicine podcast, as a speaker at the Civic Forum later this week. And like a number of the other doctors, Tro Kazanjian, he's partnered with a low carb MD, they both were like overweight kids. They both got way, way overweight, and they followed their own advice, which is to eat less and exercise more, that they've been telling their patients. Their patients never lost weight, and they just assumed the patients were lying and just eating more. It turned out that it doesn't, for most people, it doesn't work. It's
Right.
a nice idea, and it's good to exercise, but it's important not to try and diet. Dieting is like the main problem with losing weight. You say, well, how can that be? Well, there's
Yeah.
two books on that. One, Don't Diet, one, Intuitive Eating, that says what happens is we're designed to survive. God gave us two metabolic gifts, which helped us survive through the ages. One is that we gain weight rapidly in fall because we need lots of body fat to get through winter, right? Winter in Europe for thousands of years has been dangerous, and same in America. So when the nuts are ripe on the trees, the grains are ready, the fruits are ripe, people eat and gain a bunch of weight in October in order to survive the winter. Now, the problem now is it's always October in the grocery store. There's always fresh fruits, vegetables, everything you can imagine. And so we're designed to survive, and that's why this stuff tastes so good. It's not, it's not. It's what did Flip Wilson would always say? The devil made me do it whenever he bought a new dress or whatever.
How many
Um,
people know Flip Wilson? No.
yeah, I guess it dates me. But it's part of our nature, and the other part of our nature. So it's normal to gain weight. So the flip side of things is we had to deal with starvation through a great part of our history. And to the body, when you leave the table before you're full, when you try to suppress your hunger and say, yeah, I'm hungry, but I'm going to hold out because I need to lose 10 pounds, that triggers a cascade of psychological effects that sort of drives you crazy. And you can lose weight, just with willpower over, weeks or a month or two. But what happens is your metabolism steps down, your resting metabolic rate steps down, and you burn less calories just sitting and just going through your day. So the next month, the diet that allowed you to lose weight last month, you don't lose weight anymore. You gain weight and you're miserable. You're cold, you're miserable, you're grouchy because your body thinks there's not enough food. Your body thinks it's starving. So that's the wrong way, I would argue. So don't leave the table, eat till you're full. Satiety is your friend. Now, that doesn't mean you want to stuff yourself. You want to eat slowly. You want to be careful. You want to focus on your food and eat whole foods and all those things. But starving yourself has consequences, and it makes you difficult, and then you gain a bunch of weight and you blame yourself.